Hello everybody, I'm Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia. So you are on the Dr. Y channel, my dear friends. Let's continue. And today we will talk about systemic lupus erythematosus. Okay, so take your pens, papers, and let's go on. For making the notes. Anyway, I have to re-listening this video several times, my dear students. Okay, let's go. So what is systemic lupus erythematosus? Lupus is a chronic multisystem inflammatory disorder of autoimmune etiology occurring predominantly in young women. Common manifestations may include arthralgias and arthritis, Raynaud syndrome, malare, and other rashes, pleuritis or pericarditis, renal or central nervous system involvement, and autoimmune cytopenias. Diagnosis requires clinical and serological criteria. Treatment of severe ongoing active disease requires corticosteroids and immunosuppressants. So if you answer in this manner, okay, it's largely sufficient. But anyway, let's continue because we have another questions about systemic lupus erythematosus. It's the very big, very immense topic. So of all cases, 70 to 80%, 90 even percent occur in women, usually of childbearing age. Lupus erythematosus is more common and severe among Black and Asian patients than among white ones. So actually no idea, a lot of speculation about that. It can affect patients of any age, including neonates. In some countries, the prevalence of lupus reveals that of rheumatoid arthritis. Actually, this is the same problem, these autoimmune disorders. So lupus may be precipitated by currently unknown environmental triggers that cause autoimmune reactions in genetically predisposed people. Actually, some drugs also, for example, hydralazine, procainamide, isoniazid, anti-tumor necrosis factor drugs cause so-called reversible lupus reversible-like syndrome, reversible lupus-like syndrome. So, okay, but let's continue. For example, question like this. So, systemic lupus erythematosus etiology. Let's just lupus, systemic lupus erythematosus. So, SLE actually, very often we see this abbreviation. This means systemic lupus erythematosus. So, lupus, commonly known as just lupus, is a complex autoimmune disease with unknown exact etiology as all other autoimmune disorders, meaning the cause of or causes of this disease are not fully understood. However, there are several factors that are believed to contribute, consensus we've got, the factors that are believed to contribute to the development of lupus. First of all, of course, genetic determination, genetic factors, predisposition. So there is evidence that the genetic factors plays a role in development of lupus. People with a family history of lupus or other autoimmune diseases are at a higher risk of developing their condition. Multiple genes have been implicated in lupus, but no single gene have been identified as the sole cause of the disease. Environmental triggers, ecological factors, and environmental, most correct, of course. Environmental factors such as exposure to certain chemicals, drugs, infections, and ultraviolet radiation have been suggested as the possible triggers for lupus. These triggers may stimulate the immune system and cause it to attack the body's own tissues, leading to development of lupus in susceptible individuals. Hormonal factors, specifically the female sex hormones estrogen and progesterone, are thought to play a role in lupus. The majority of lupus patients are women, and the disease often develops or worsening during pregnancy or just after childbirth, suggesting an hormonal influence. No, might be. Immunological factors. Dysregulation of the immune system is a hallmark of lupus. It's believed that in people with lupus, the immune system mistakenly attacks the body's own cells and tissues, leading to inflammation and damage in various organs. So that's why it's autoimmune disorder. Epigenetic factors. Epigenetic changes, which are modifications to gene expressions without changes to underlying DNA sequence, have been implicated in the development of lupus. These changes may be triggered by environmental factors and can affect the functioning of immune cells, leading to increased risk of developing condition, lupus. It's likely that a combination of genetic, environmental, hormonal, immunological, of course, and epigenetic factors contribute to the development of lupus. However, the exact mechanisms are triggers are still not fully understood, as we have mentioned above, and further research, of course, is needed to better understand the etiology of this complex autoimmune disease. So, answer like this is excellent. More than excellent. Systemic lupus erythematosus pathogenesis. Pathology, pathophysiology, pathogenetics, classic scheme of questions. So the pathogenesis of lupus involves a complex interplay of various immunological and inflammatory mechanisms that results in the characteristic autoimmune response and multi-organ involvement seen in the disease. While the exact pathogenesis of lupus is not fully understood, we've got several key factors. For example, so-called loss of tolerance. In lupus, the immune system loses its ability to distinguish between self and not self, leading to the production of autoantibodies that target the body's own cells, tissues and organs, connective tissue. This loss of tolerance may result from various mechanisms, including genetic factors, defects in immune regulation, and environmental triggers. Immune complex formation also, second point. Immune complexes which are formed by the binding of autoantibodies to self-antigens can accumulate in various tissues and organs in lupus. These immune complexes can activate the complement system, leading to inflammation and tissue damage. Third point, inflammation and cytokine dysregulation. Inflammation plays a central role in the pathogenesis of lupus erythematosus. Actually, inflammation plays a role in any disorder. But anyway, so inflammation plays a role, a hallmark role. Abnormal production of a pro-inflammatory cytokines such as tumor necrosis factor, TNF-alpha, interleukin-6, IL-6, and interferon-alpha, IFN-alpha, as well as other mediators of inflammation can contribute to the immune system dysregulation and tissue damage seen in lupus. Abnormal Bursa cells, B cell, and plasma cell activation. B cells play a crucial role in the production of autoantibodies in lupus. Abnormal activation of B cells and plasma cells, along with defects in B cell tolerance checkpoints, can result in the production of autoantibodies that target self-antigens and contribute to the pathogenesis of lupus. Genetic factors. Genetic factors have been implicated in the development of lupus, with multiple genes identified as potential risk factors. These genes are involved in various immune-related pathways, including immune regulations, apoptosis, and cytokine signaling. Signs signaling, and may contribute to the dysregulation of the immune system in lupus. Environmental triggers, environmental factors such as infections. Actually, infections is a trigger of all autoimmune reactions, of how autoimmune can be, very easy peasy. Anyway, so infections, exposures to ultraviolet radiation, and certain medications have been proposed as the triggers for lupus. These factors can potentially stimulate the immune system and trigger the development of lupus in genetically susceptible, predisposed individuals. It's important that lupus is a complex and heterogeneous disease, and the pathogenesis may vary among different individuals. The interplay between genetic, environmental, and epigenetic factors likely contributes to development and progression of lupus, and further research is needed to fully understand the intricate mechanisms involved in the pathogenesis of this autoimmune disease. Actually, my friends, if you want to decide it, if you want to be an immunologist, autoimmune disorders will be the principal cause of the problem, one of the principal causes. Now it's one of the principal, and it will be greater and greater. So it's a good thing to do, if you want to be an immunologist, or a specialist in rheumatology. Actually, it's a rheumatologist. Good advice to be a good rheumatologist. Next question is lupus classification. So lupus is classified based on various criteria, including clinical manifestations, laboratory findings, organ involvement. Classification criteria for lupus has been established by different organizations, such as, for example, American College of Rheumatology, ACR, and the Systemic Lupus International Collaborating Clinics, SLIC, S-L-I-C-C. SLIC, Classification criteria are used to identify and categorize patients with lupus to research and clinical purposes. The most commonly used classification for lupus is classification criteria is ACR criteria. R criteria, which includes 11 criteria that require the presence of at least four classification as lupus. So at least 4 points. So one of the 11, or 4 from the 11, at least 4. First of all, of course, malar rash, classic rash, butterfly, a characteristic rash that appears over the cheek and nose, often referred as a butterfly rash. Discoid rash, so that's why discoid lupus, a skin rash that appears as a circular scaly patches. Photosensitivity, skin rash or other symptoms that are triggered by sunlight, all ultraviolet exposure. Oral ulcers or sores in the mouth or nose that are painless. Arthritis, joint pain and swelling in 2 or more joints. Serositis, inflammation of the lining of the lungs, pleuritis or heart, pericarditis. Kidney involvement, abnormal urinary findings or kidney biopsy indicating kidney damage. Neurological involvement, seizures of psychosis or other symptoms indicating central nervous system involvement, seizure or psychosis. Then hematologic involvement, abnormal blood cells count such as anemia, leukopenia, and thrombocytopenia. Immunologic involvement, presence of abnormal immune markers such as anti-dsDNA antibodies, anti-SM antibodies, or positive antiphospholipid antibodies. And anti-nuclear antibody, famous ANA, presence of ANA. Presence of ANA is not the name, anti-nuclear antibody, in the blood. In addition to the ACR criteria, the SLIC criteria, which were developed in 2012, are also commonly used. The SLIC criteria include 17 items and require the presence of at least 4 of them, including at least 1 clinical criterion and immunological criterion or biopsy-proven lupus nephritis for classification as a lupus. It's important to know that the classification criteria are meant for research and clinical purposes, are not intended for diagnosis. Diagnosis of lupus should be based on a comprehensive evaluation of patient's medical history, of course, physical examination, of course, laboratory findings, of course, and clinical judgment, if you've got that one, by a qualified professional, not doctor, healthcare professional. Next is the clinic. So clinic, once again, clinics means symptoms and signs, clinical marks, symptoms and signs. So lupus is a chronic autoimmune disease that can affect multiple organs and systems in the body. That's why it's an autoimmune systemic disorder. And its symptoms can vary widely from person to person. The most common symptoms and signs for lupus include fatigue, so persistent and explained fatigue, often described as extreme tiredness or lack of energy. Then joint pain and swelling, arthritis, typically involving the small joints of the hands, wrists, and feet. Joint pain and swelling may be migratory and can come and go over time. Skin rash, a characteristic butterfly-shaped rash over the cheeks and nose, also known as a malar rash. Other skin rashes, such as discoid rash or photosensitive rash, may also occur. Fever, you've got me fever, so you give me fever. Unexplained fever, often low grade, may occur in lupus due to inflammation and immune system dysregulation. Photosensitivity, sensitivity to sunlight or ultraviolet light leading to skin rash or other symptoms upon exposure to sunlight. Oral ulcers, painful source of ulcers in the mouth or nose. So painful or painless. Raynaud's phenomenon, color changes, pallor, cyanosis or redness in the fingers or toes upon exposure to cold or stress. Raynaud phenomena. Raynaud syndrome, Raynaud phenomena. Kidney involvement, symptoms such as foamy urine, foamy swelling in the legs, and high blood pressure may indicate kidney involvement, which is common in lupus. Chest pain and breathing difficulties, pleurisy, inflammation of the lining of the lungs, can cause chest pain and discomfort, may be accompanied by difficulty breathing. Neurological symptoms, headaches, seizures, confusion, memory problems, and other neurologic symptoms may occur in lupus due to CNS, central nervous system involvement. Hematologic abnormalities, anemia, low red blood cell count, leukopenia, low white blood cell count, thrombocytopenia, low platelet count, and other blood abnormalities may be present in lupus. Immunologic abnormalities, presence of abnormal immune markers in the blood, such as anti-nuclear antibodies, ANA, anti-dsDNA antibodies, and anti-phospholipid antibodies. Other symptoms, lupus can also cause a wide range of other symptoms, such as hair loss, mouth sores, swollen lymph nodes, weight loss, and muscle pain. But anyway, it's important to note that lupus symptoms can vary greatly among individuals, and not all patients with lupus will experience all above mentioned symptoms. Additionally, the severity and frequency of symptoms can also vary over the time with the same person, with periods of remission and flares. No, remission of flares. If you suspect, okay. No, it's another question. What's another question? Variants. No, okay, clinical. Understand. Variants of lupus. Okay, let's go. So lupus is a complex autoimmune disease that can present in various forms or variants. For example, let's talk about principal ones of the variants. Cutaneous lupus erythematosus. This variety of lupus primarily affects the skin and presents with skin-related symptoms. There are three main subtypes of cutaneous lupus erythematosus. Discoid lupus erythematosus, characterized by round or disc-shaped lesions on the skin that may be scaly and cause scarring. So that's why it's lupus, like wolf biting. Lupus is a wolf. Subacute cutaneous lupus erythematosus, CCLE, characterized as CLE. No, actually, subacute cutaneous lupus erythematosus characterized by photosensitive rashes that are typically widespread and may resemble psoriasis or other dermatological conditions. Actually, psoriasis also autoimmune disorder. Lupus profundus or lupus paniculitis, a rare form of cutaneous lupus erythematosus that affects the subcutaneous fat and presents as nodules or lumps under the skin. Then another variant, second one, drug-induced lupus erythematosus. The variant of lupus is caused by this variant, drug-induced, by certain medications, we understand by name, and the symptoms usually resolve after discontinuing of the offending drug. Common medications associated with this type of lupus: hydralazine, procainamide, isoniazid, and some anti-seizure medications. Neonatal lupus, a rare variant of lupus that occurs in newborns whose mothers have autoantibodies against specific proteins associated with lupus, such as RO-SSA and LA-SSB antibodies. Neonatal lupus can cause skin rash, liver abnormalities, and heart block in the newborn, but most infants recover fully without long-term complications. Thanks God. Lupus nephritis. This variant of lupus involves inflammatory of the kidneys, leading to kidney damage and dysfunction. Lupus nephritis can range from mild to severe and require careful monitoring and management to prevent kidney damage. Central nervous system lupus. This variant of lupus involves inflammation of the central nervous system, including the brain and spinal cord. CNS central nervous system lupus can cause a wide range of neurological symptoms such as headache, seizures, cognitive dysfunction, mood disorders, and more. Cardiac lupus, heart lupus, cardiac lupus, DIL lupus. This variant of lupus involves inflammation of the heart and may present as a pericarditis, myocarditis, or other forms of cardiac involvement. So it's important to note that while these are recognized variants of lupus, many patients with lupus may experience a combination of different manifestations, as we understand why, because it's the same problem, the same chain, the same links of the same chain, links of the same chain. And the disease can be highly variable in the presentation and course. Proper diagnosis and management of lupus and its variants require careful evaluation by a qualified professional with expertise not this doctor, rheumatologist, in autoimmune diseases. Pathomorphological changes of lupus. The pathomorphological changes in lupus are diverse and can affect multiple organs and tissues in the body. The exact pathogenesis of lupus is not fully understood, but it's believed to involve a complex interplay of genetic, environmental, hormonal, and immunological factors that result in the immune system attacking the body's own tissues. Kidney, for example. One of the more common organs affected by lupus is the kidneys. Lupus nephritis is characterized by immune complex deposition in the glomeruli of the kidneys, leading to inflammation and damage to the renal tissue. These can result in various histological patterns, ranging from mild mesangial proliferation to severe diffuse proliferative glomerulonephritis with crescent formation and fibrosis. Skin biopsies in lupus may also show a variety of changes, including interface dermatitis with lymphocytic infiltration and epidermal junction, basement membrane thickening, and deposition of immune complexes in the skin. Discoid lupus erythematosus, a subtype of cutaneous lupus, may show hyperkeratosis, follicular plugging, and atrophy of the epidermis, as well as lymphocytic infiltrate in dermis. Joints. Synovial membranes in the joints may show synovitis, which is characterized by inflammatory infiltrates, synovial hyperplasia, and destruction of cartilage and bone. Blood vessels. Inflammation of blood vessels, known as vasculitis, can occur in lupus and may involve small vessels or larger vessels. Vasculitis can cause damage to blood vessel walls, leading to tissue ischemia and necrosis. Heart. Cardiac involvement in lupus may show various pathomorphological changes, including pericarditis, inflammation of the pericardium, myocarditis, inflammation of the myocardium, heart muscle, and endocarditis. Endocarditis is inflammation of heart valves. Endocarditis. Heart valve is endocardium, of course. These changes can involve inflammatory infiltrates, fibrosis, and immune complex deposition. Lungs. Lungs biopsies in lupus may show pleuritis, inflammation of the lining of the lining of the lungs. Interstitial lung disease, inflammation and fibrosis of lung tissue, or pulmonary hypertension, increased blood pressure in the lungs. These changes can result in respiratory symptoms and reduced lung function. And finally, central nervous system involves in lupus may show various changes, including inflammation of the meninges, blood vessels, or brain tissue. These changes can result in a wide range of neurological symptoms depending on the location and extent of the involvement. It's important to know the pathomorphological changes in lupus can be highly variable and may differ among individuals. Proper diagnosis and management of lupus require thorough evaluation by a qualified healthcare professional, including clinical assessment, in laboratory testing, and imaging studies, in addition to histopathological examination and of affected organs or tissues. Diagnosis and differential diagnosis of lupus. Diagnosis typically involves a combination of clinical evaluation, laboratory tests, imaging studies. There is no single definitive test for lupus erythematosus, and the diagnosis is often based on a combination of clinical features and laboratory findings. Differential diagnosis is important to rule out other conditions that may present with similar symptoms. Okay, good, let's go. Diagnosis. So clinical evaluation. A healthcare professional, so you, take a detailed medical history and perform thorough physical examination for characteristic signs and symptoms of lupus, such as skin rash, joint pain, fever, oral ulcers, and photosensitivity. Laboratory tests. Blood tests are commonly used in the diagnosis of lupus. These may include ANA, antinuclear antibody test. ANA is commonly is a common autoantibody that is present in many patients with lupus. A positive ANA test along with compatible clinical findings can be suggestive of lupus, but it's not highly specific for lupus, as it can also be positive in other autoimmune diseases, of course. Other autoantibody tests for other autoantibodies such as anti-double-stranded DNA and others may also be performed to aid in the diagnosis of lupus. Complete blood count can show characteristic changes in lupus. Or maybe, why not, such as anemia, leukopenia, low white blood cell count, or thrombocytopenia, low platelet count. Complement levels, complement proteins such as C3 complement, complement 3, complement 4, are often decreased in lupus due to consumption during the immune response. Kidney function tests, urinalysis and measurement of serum creatinine and blood urea nitrogen (BUN) levels may be performed to assess kidney function, as lupus nephritis is a common manifestation of lupus. Imaging techniques, imaging studies such as X-ray, ultrasound, MRI may be used to evaluate specific organs or tissues for signs of inflammation or damage depending on the clinical presentation. Differential diagnosis, several other conditions can present with similar clinical features as lupus, and thorough differential diagnosis is important to rule out other possible causes. Some of the conditions that may be considered in differential diagnosis of lupus include other autoimmune disease, conditions such as rheumatoid arthritis, Sjogren's syndrome, systemic sclerosis, and mixed connective tissue disease can have overlapping clinical features with lupus and may need to be ruled out. Infections, certain infections such as viral infections, for example, viral hepatitis, bacterial infections, Lyme disease, and fungal infections can mimic lupus symptoms. Drug-induced lupus, some medications such as procainamide, hydralazine, and isoniazid can cause drug-induced lupus, which may have similar symptoms to lupus. Discontinuing the offending medication usually leads to resolution of symptoms. Iatrogenic, of course. Other inflammatory or autoimmune conditions such as vasculitis, dermatomyositis, sarcoidosis, and others may need to be considered in differential diagnosis, as they can present with similar symptoms. Other known autoimmune conditions such as fibromyalgia, chronic fatigue syndrome, and malignancies can also present with symptoms that overlap with lupus. Environmental factors, exposure to certain environmental triggers such as ultraviolet or sunlight, or certain medications may exacerbate or trigger lupus-like symptoms in susceptible individuals. Treatment for lupus typically involves a multidisciplinary approach and is tailored to the severity and specific manifestations of the disease in each individual. The primary goals of treatment are to control disease activity, manage symptoms, prevent organ damage, and improve quality of life. Treatment plans are often individualized and may involve a combination of medications, of course lifestyle modifications, and supportive care. Let's go. Non-steroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen, naproxen, may be used to relieve mild joint pain and inflammation in lupus. Corticosteroids, such as prednisone, are powerful anti-inflammatory medications that are commonly used to control moderate to severe disease activity in lupus. They may be used in short-term high dose during disease flares and then tapered to the lowest effective dose to minimize side effects. Disease-modifying anti-arrhythmic drugs, anti-rheumatic drugs. Disease-modifying anti-rheumatic drugs, DMARDs such as hydroxychloroquine, methotrexate, azathioprine, and mycophenolate mofetil are commonly used in the treatment of lupus to control disease activity and prevent organ damage. They work by suppressing the immune system and reducing inflammation. Fashionable biologic therapies. Biologic therapies such as belimumab are a newer class of medications specifically approved for the treatment of lupus. They target specific components of the immune system to reduce disease activity. Immunosuppressive agents such as cyclophosphamide may be used in severe cases of lupus, particularly when there is an organ involvement such as lupus nephritis. These medications work by suppressing the immune system to reduce inflammation and prevent organ damage. Supportive care measures such as protection, regular exercise, of course, healthy diet and adequate rest are important in managing lupus. Additionally, managing comorbidities such as hypertension, diabetes, and high cholesterol is crucial in the overall management of lupus. Actually, very highly questionable. No, of course, patient education and counseling. Patient education and counseling play a vital role in managing lupus. This may include educating patients about the nature of the disease, lifestyle modifications, medication adherence, and self-monitoring of symptoms. It's important. What is important? Yeah, it's important to note that treatment approach of lupus may vary depending on the severity of the disease, individual patient characteristic, and response to treatment. Lupus prevention of exacerbation. Prevention of exacerbations. Okay. Preventing exacerbations or flares, so-called flares, flares and remission. Prevention of exacerbation or flares in lupus can be challenging, as the exact cause of flares is not always clear. However, there are some general strategies that may help reduce the risk of lupus exacerbations. Medication adherence. No, it's okay for any chronic disease. Taking medications as prescribed by a doctor is crucial in managing lupus and preventing flares. Skipping doses or stopping medications abruptly can highly increase the risk of disease activity, exacerbations, complications, flare, etc., etc. It's important to work closely with doctor and working in tandem with patient. Avoiding triggers. Identifying and avoiding triggers that can worsen lupus symptoms or trigger flares can be helpful. Commonly, triggers may include exposure to sunlight, certain medications, infections, stress, and hormonal changes. Keeping a journal to track potential triggers and discussing them with doctor can help to develop strategies to avoid, to minimize their impact. Actually, we have to work in tandem with patient, of course. Managing stress. Stress has been linked to exacerbation of lupus symptoms in some patients, all patients actually, in all diseases, in all conditions. Finding effective ways to manage stress. Someone can manage my stress, such as through relaxation techniques, meditation, exercise, and counseling, may help reduce the risk of flares in some individuals. Protecting from sunlight. Sunlight and ultraviolet radiation can trigger flares of lupus. In some patients, it's important to protect from direct sunlight by wearing protective clothing, such as wide-brimmed hats and long-sleeved clothing, and using broad-spectrum sunscreen with the highest SPF, sun protection. Avoiding excessive sun exposure, especially during peak hours, and using ultraviolet protective sunglasses can also be beneficial. Yes, regular follow-up appointments. So regular follow-up appointments, checkups, and healthy lifestyle. Maintaining a healthy lifestyle, including regular exercise, balanced diet, adequate sleep, and avoid smoking, quit smoking and exercise. Excessive alcohol consumption can support overall health and immune function, which may help reduce the risk of lupus flares. So it's important to know that preventing of lupus exacerbations may not always be possible, as we described, as the disease can be unpredictable, absolutely, and vary greatly among individuals. So that's all. 40 minutes of talking. Of course, we have no time for if one question 40 minutes. Of course, it's impossible. So anyway, this all information I think is largely sufficient for you, my friends. I know this is a lot of information, but anyway, well, you have to know that. So keep in touch. Follow and subscribe our channel. Re-listening this video several times. See you in another lectures. Bye bye.